Hi, Dr. Scott Jensen here. I want to talk about public health and the fact that trust in public health advice is paper thin in America. And it seems like there's a deadly game of Simon Says going on, where Simon evidently is the public health officials. And Simon says, do this, and we're supposed to do this. And if it isn't Simon Says, then whoever says it isn't to be believed. So this is a deadly game. And I want to share with you that this is my opinion, and this is not medical advice for you. It's my opinion based on all the reading I do and the interactions I have with thousands and thousands of people every month. So let me just start with this. I want to talk about masks, and I want to talk about vaccine mandates. Let's start with the vaccine mandates. It grieves me to think that we have young people being forced into taking a vaccine, which certainly is open to criticism. I think that a recent Kaiser study coming out saying that 34% of Americans believe that the vaccines caused significant problems or deaths is an issue. You can find that through the Kaiser website, and you can look at the data specifically. But this is a clear indication that we are not talking about a bunch of wacko conspiracy theorists that are out to lunch. We're talking about 1 out of 3 Americans believing that vaccines have caused significant problems. If you look at the VAERS program, the Vaccine Adverse Event Reporting System, the data is clear. The COVID vaccines have had more problems associated with them than by far any other vaccine over the last 20 years. And the notion that college educations and nursing programs may be absolutely halted because a young person says no thank you to a vaccine, particularly in light of the fact that more than 90% of Americans have had COVID. I think we've now put to rest this idiotic notion that natural immunity doesn't matter. But this idea of vaccine mandates is just wrong-headed. And we have got to try to build public trust, not decimate it further. So I would just say this fear-mongering and this wicked, deadly game of Simon says this, so you do this, has got to stop. I think that it's clear that the BA viruses, which are basically subvariants of the Omicron, are clearly not as vicious, not as virulent. Yes, they're very transmissible, but this present subvariant that's moving through our country may not even be adequately protected by any significant level with the vaccine that's coming out in the next few weeks. So let me say that again. The subvariant that is an Omicron descendant, and I believe it's BA, I'm not sure which, it's maybe BA 286. If you remember, the BA references Omicron descendants, AY represents Delta descendants. But the bottom line is that the Omicron descendants have not been as virulent and are very transmissible. Very extensive research has been done indicating that probably more than 90% of Americans have had COVID. I think our president has been vaccinated numerous times and had COVID at least a couple of times. The idea of mandating young people to get this vaccine is just wrong-headed. There are countries, first world countries, that have halted their vaccine program for people under the age of 60, unless there's extenuating circumstances. So really, folks, I am just astonished. I am just astonished at what's going on. Now I want to switch gears and go to masks. Recent article in Daily Mail came out and talked about a mask study published by NIH. Suggests that N95 COVID masks may expose wearers to dangerous levels of toxic compounds linked to seizures and cancer. This was written by Emily Joshu, a health reporter for Daily Mail. It says this: the surgical N95 mask has been held up as the gold standard, but a study quietly reshared by the National Institutes of Health in the spring suggests the tight-fitting mask may expose users to dangerous levels of toxic chemicals. Researchers from the Jeonbuk National University in South Korea looked at different kinds of masks, and the study found that chemicals released by these masks had 8 times the recommended safety limit of toxic volatile organic compounds. This is a big deal. This is potentially why people get sick wearing masks. I know many of you don't have any trouble wearing masks. Good for you. That's terrific. But many people do have trouble. The study was published in the journal Ecotoxicology and Environmental Safety, and it's on the NIH's website. Dr. Stuart Fisher, an internal medicine physician in New York, told Daily Mail that increasingly evidence has shown the drawbacks of mask wearing. He added that, quote, there seems to be diminishing returns on the need for masks, period, end quote. It's probably important for you to recognize that KF94 masks are popularized in South Korea, while in the US it's more the KN95s. And these are, if you will, the N95 masks. The KF94s filter 94% of particles of a certain size, while the KN95s filter 95%. Toxic volatile organic compounds have been shown to irritate the eyes, nose, and throat, cause difficulty breathing and nausea, and damage the central nervous system and organs like the liver, according to the American Lung Association. According to this article I referenced, some are even considered human carcinogens. The researchers specifically flagged the chemicals dimethylacetamide and dimethylformamide. Research carried out by the Cochrane Institute, released not too long ago, suggested that face masks made little to no difference in COVID infections and deaths. And if you're not familiar with the Cochrane Institute, I will tell you that they are a highly reputable source of research information. Frequently, the Cochrane Institute will do meta-analyses where they'll take dozens or hundreds of studies and coalesce the information in those studies and come out with a pronouncement as to what really is the situation. This Dr. Fisher I referenced earlier said, COVID won't be going away for a long time, if ever. We desperately need policies that do not fracture our society while providing minimal protection. Those are Dr. Fisher's words from New York, not mine. And then if you look at a recent article written in the Epoch Times, Megan Redshaw, an attorney, August 21st, 2023, talked about documents recently obtained from the NIH that suggest public health officials used inaccurate information and misrepresented medical research to advance their policy objective that masks prevent severe COVID-19 and virus transmission, despite opposing scientific evidence received from experts. In a letter in November of 2021 sent to the Center for Disease Control, top epidemiologist Mike Osterholm informed the agency it was promoting flawed data and excluding data that did not reinforce their narrative. He went on to talk about this. We believe the information and recommendations as provided may actually put an individual at increased risk of becoming infected with SARS-CoV-2 and for them to experience a serious or even life-threatening infection, Mr. Osterholm wrote. It appears that he's talking about, please don't provide a false reassurance that you shouldn't be providing. In his letter to the CDC, Mike Osterholm asked the CDC to remove the suggestion that masking prevents severe COVID-19. Mr. Osterholm said, the November 2020 Cochrane Review, again, referencing Cochrane, the Cochrane Review states this, quote, compared with wearing no mask, wearing a mask may make little to no difference in how many people caught a flu-like illness. And again, flu-like illnesses are very similar to COVID in that they are RNA viruses. They're similar size, approximately 0.1 micron. Friends, this is astonishing. This is like a washing machine. Rinse and repeat, rinse and repeat. And we've got this Simon Says character, and we don't know who Simon is. The public trust in the CDC, the World Health Organization, the FDA has been compromised deeply. The FDA has come out and said that we'll approve certain medications, and scientists on their advisory committees have quit after they've done this. The FDA is at some level funded by big pharma in and of itself. The CDC has had stumbles and bumbles like no tomorrow. And we're wondering, how can you do this? You can't make this kind of stuff up. It sounds like a grade B novel or a grade B movie that's playing out right in front of our eyes. If people want to wear masks, that's fine. But understand that We don't have 100% filtration of viral particles from any of the masks. And understand that wearing masks can have adverse effects. We need to step back and recognize that we've been through 3.5 years of hellacious policies put forth by people frequently ginning up data to support a narrative that they have decided needs to be promoted. Right now, late August, we're seeing masks and vaccine mandates rising up, despite the fact that there's clear, reasonable evidence that the vaccines are not doing what we were told they were doing. I have seen patients in the office that have had 5 or 6 vaccines and still gotten COVID a couple of times. We should not be doing this to America. We should not be doing this to humans on our planet. Masks, if you want to wear them, fine. Go ahead. Your choice. But for heaven's sakes, don't force them down people's throats and don't be premature. I just saw U.S. senators on both sides of the aisle in different settings across the country not wearing masks and interfacing with people, laughing and guffawing and enjoying one another. I saw pictures of U.S. Senator Amy Klobuchar at the state fair having a good time with people, and they're not wearing masks. And now we see the vaccine mandate being raised up. And I just got a call from a mom the other day who was just sick because her daughter may not be able to finish her program of study in college. She's a senior, and she only has a few rotations left. But all of a sudden, the college is saying, you don't get vaccinated, you don't get to finish. Folks, this is just wrong. This is wrong on so many levels. We've got to stop this. Physicians, I would plead with you. Work with your patients. They need you walking by their side. Patients are frustrated and angry and feeling betrayed and abandoned. This is our time to step up and build trust. We're better than this. There is no evidence out there right now that indicates that we should be rinsing and repeating flawed, failed policies. Simon says, that's a bogus game. It's a bogus game born of a nefarious agenda. This should not be about control and power. We should be talking about Americans living side by side, working to rebuild trust, rebuild normalcy, letting our kids go to school, not making them afraid, not providing false reassurance that we shouldn't be providing. Yes, masks can filter a certain percentage of particles, but no mask has been demonstrated to provide ironclad guarantee that you won't get COVID-19. So let's not put that out there. If Simon is indeed the CDC or public health officials, Simon is playing a wicked game, and we should not be playing it with him.